Hi everyone, I'm Dr. Mara Weinstein. I'm a board-certified dermatologist, and today we're going to walk through a day in the life of a cosmetic dermatologist. I'm fellowship trained, which means I spent an extra year learning all about the science and technology behind the development of lasers and injectables. In fact, I was involved in some of the most critical clinical trials that launched devices into the market. And so today I'm excited to show you what we do on a day-to-day basis. So the first procedure we're starting out with is called the soft wave. So this is an ultrasound-based technology. It delivers heat under the skin into what we call the dermis, so the deeper part of dermal tissue, where our collagen-producing cells live, called fibroblasts. And what it does is it stimulates the development of collagen and elastin to help lift and tighten the skin. Now, SoftWave also has FDA indications to treat cellulite, to reduce the appearance of wrinkles, and to lift the skin. So it's really a wonderful procedure. You can see my patient here is super comfortable. The procedure starts by just applying some ultrasound gel to the skin, and then we deliver those pulses sequentially across the face and the neck and the body, or wherever we're treating, to achieve those results. In terms of prep for SoftWave, so this patient numbs for about an hour prior to the treatment. We put a topical numbing cream on the face, and then the procedure itself takes about 40 minutes or so because we want to be super thorough, especially for treating neck and face. There are also indications for SoftWave to do a nice brow lift, so non-surgical brow lift, which has amazing results, and also a little bit of a lip lift, so you can get that fullness and sort of eversion of the lip without having injections, which is amazing. Post-procedures, there is really no downtime. So this patient will walk out, she'll be a little bit pink, but there's no tenderness, no change on the skin, and really no downtime. So she can go to lunch with her friends or go to the gym right after. That's really the magic of SoftWave. We recommend patients getting it at least once a year as a maintenance type procedure. So to maintain the structure of the face, if your goal is really to lift and tighten and stimulate collagen and elastic fibers, maintaining once a year is going to be key. Now, if you come in maybe in your late 40s or 50s or beyond, you might want to think about getting it more often. So every 3 to 6 months would be reasonable. I have a lot of patients who sort of just come in on a regular basis. So every 3 months we do a soft wave, we do a little neuromodulator, and they're really able to maintain their skin and facial structure that way. So you can see my nurse, Nancy, who's a certified dermatology registered nurse, is performing the procedure. Nancy does a lot of our soft waves. She's really an expert in this procedure and has treated patients now for over 4 years with amazing outcomes. So we work together as a team to develop their treatment plan and protocols. And then Nancy is wonderfully patient and does most of these procedures. Next up, we're in the cool sculpting room. So we have a few patients today. We're going to get cool sculpting. It is a device that selectively freezes fat cells. So it's actually called cryolipolysis. That's a medical name. It's been around for over 10 years. It's proven to be safe and effective. And it's best when patients are already kind of in shape and they just have stubborn areas of fat that they want to reduce. So we often hear that patients feel like their clothes fit better. They feel like their contours in a dress look better. It's not a weight loss procedure by any means, but it really is meant to shave stubborn areas of fat. So we'll walk through the way that the device works. There are so many areas that cool sculpting can be used for, including the abdominal fat, the love handles. We call these areas the bat wing on a lot of patients, so the loose skin under your arms. We can do submental fat or double chin. We can also do bra fat, back fat, leg fat. I mean, you name it. It can really treat any area of skin where you can pinch a little bit of subcutaneous or superficial fat and help to reduce that fatty layer. Typically, depending on how much fat is in the area, it does require a few sessions, so maybe 2 to 3 sessions of the applicator being applied to that specific treatment area to achieve the results that you're looking for. It takes about 12 weeks to see the final result after the first treatment. So if we bring you back for pictures, we'll have pictures on day 1, which is our baseline, and then we'll take pictures 12 weeks later. But that doesn't mean you can't be treated in between those 12 weeks. So if you're getting multiple areas or multiple treatments, we'll bring you back probably every 4 weeks or so to continue your treatment regimen. We kind of determine the maximum area of fullness, which is right here. Okay. And actually what I do is I put a little X right where we see the most ones. And on this side, right over here. So then I line up our measuring tool and we go right over the X and we're going to put where it ends. That is the area that we treat, and people like to see, you can, if you can pinch it, you can treat it. Okay, so we've marked our areas. We're treating the lower abdomen, and the next step is to wipe the skin with the pre-treatment skin wipe. So this is just to ensure that the applicator will go on smoothly and that there's no residue on the skin. Okay, that's good.
Yep, that's good.
Next, we apply a gel pad. That helps to protect the skin from the device when we start that cooling process. This is meant to protect the overlying skin. Gel pad, check. That turns it on. Okay. And you're going to take a deep breath in and blow out. And there we go. Except there's a hissing noise. That's it. Let us know if you have any issue.
Thank you. Appreciate it.
So this is one of my favorite procedures. We do a lot of lasers in the fall and the winter, mainly because there's less sun out. It's easier for patients to recover. But next up today, we're going to do a halo on this lovely patient. She comes in for concern of some acne scarring, some textural changes on the skin. And so we are going to help to resurface the skin today with the halo. As you see, our nurse is removing some numbing cream that's been on her skin for about an hour and a half. Typically, we ask you to come early for your appointment and the numbing cream stays on for an hour to an hour and a half. The longer the better, but honestly, people's pain tolerances are so different, so we just try our best to make you the most comfortable. We also have Pronox as an option for pain control, which is nitrous oxide. It's like a medicine that you inhale to help put you in a euphoric state, and usually when we offer that to patients, they're very pleased and the procedure goes seamlessly. What's great about Pronox is that it wears off in about 4 to 7 minutes, and so really you don't need a ride. You can come right in, we administer the Pronox, and then you're able to leave about 4 to 7 minutes later after it wears off. So the halo is actually a hybrid laser. We call it hybrid because there's a fractionated ablative portion. That means that it actually vaporizes the tissue in a fractionated manner, which you'll see it's kind of like a grid pattern. And that's a very top layer of tissue that it's able to ablate superficially. And then there is a non-ablative portion of the laser, which delivers heat deeper under the skin to stimulate collagen and tissue remodeling to help remodel scars and improve the texture of the skin. We use this laser not only for acne scarring, but fine lines, wrinkles, overall facial rejuvenation to improve that radiance and stimulate your collagen so that you get more youthful, glowing looking skin. Now, there are also studies that show that maintaining procedures like the halo or non-ablative fractionated laser can help prevent the development of non-melanoma skin cancer. So things like basal cell skin cancer or squamous cell. So if you're somebody who's had a non-melanoma skin cancer before, maintaining your skin with procedures like the halo would be a great way to prevent the reoccurrence of those. Now, our patient's very young and she has not had issues with skin cancer, but so today we're doing this for a different purpose. But it's important to know all of the different uses for a laser of this type. For acne scars, we recommend a series of laser treatments, so we can do them as often as every month. Typically for acne scarring patients, we recommend 2 to 4 treatments, and it's so variable. It just depends on how long you've had the scars, how deep they are, what the pattern is. Are they rolling type scars? Are they more etched into the skin and angulated like boxcar scars? Or are they what we call ice pick scars, which means they're little like pin pricks or divots in the skin, which are the hardest to treat. Often we can combine halo with other procedures like TCA Cross, which is a chemical peeling agent that we use especially for those ice pick scars. We can also combine halo with a procedure like excision, which is where we get under the skin and really release the tethers that contribute to the bound down nature of scars on the face just after years of having inflammatory type acne. Post-procedure, our patient's gonna feel like she got a sunburn, so the face is going to be pink and hot. It's not uncommon to see a little bit of pinpoint bleeding. That's just from that ablative portion of the laser that I described. We give you ice packs and cold cloths, which you'll see during the procedure to help with that sensation of heat. So this is a procedure that requires a little bit of downtime. So typically a long weekend would be fine. So if you came in on a Thursday, for example, took Friday off, you could probably go back to work Monday or Tuesday. And the reason why is because the skin gets a little swollen, puffy. That lasts about a day or two. And then you're gonna have what we call MENS on the skin, which stands for microscopic epidermal necrotic debris. And this is all of those dead skin cells sort of extruding themselves through the surface in a grid-like pattern, and over time that'll slough. So it's really not a uncomfortable thing or painful. It's just that your face will look like you had a procedure done. So we do recommend that little bit of downtime post halo. So we just completed the halo. How do you feel?
Good.
What does your skin feel like?
A little tight and a little bit of burning, but not bad at all.
So kind of like a sunburn, or?
Yeah.
Okay, great. Do you feel like you could go out to dinner tonight?
I mean, me, yes, I could.
So what you're seeing on her skin are these pinpoint areas of bleeding. This is from the ablative portion of the laser. The 2940 is the erbium YAG. So you can see all those little white dots and the pinpoint bleeding, which is what we want to see post laser. And so you can see where we hit sort of in a grid-like pattern, the very superficial surface of her skin. We were at about 100 microns with the ablative portion of this halo laser. So all of these little white dots will kind of rise to the surface even more, and then they'll slough off over the next 4 days, and she'll feel like there's baby skin underneath. It's quite remarkable. And then the surrounding redness is from the non-ablative portion of the laser, which is what delivered energy deeper under the tissue to denature collagen, which in a sense re-stimulates collagen and leads to wound healing. So we are attempting to remodel and re-heal the textured areas on the skin, which are a result of acne scars. And so over the next few days, again, all of these dots will rise to the surface. Those dots are called MENS, and they'll slough off, and it'll really look like baby skin underneath. But for acne scarring, we'll need a series of treatments. Every sequential treatment, those scars will become more shallow, but it does take time. We're getting ready to do an enlightened procedure. This is a picosecond laser, so it fires at 1 trillionth of a second, which is really fast. And the way that it works is with the sheer speed of the pulse, it helps to break apart tissue, break apart melanin, and tattoo pigment specifically under the skin to help remove tattoos. And I like it for removing brown spots. And so we can spot treat with this device and get close to sensitive areas like the eye or in small areas on the nose. It's a really great kind of spot treatment. And then you'll see after we go through and use a different wavelength, the 1064 wavelength, to treat the entire skin for a pico toning effect or facial rejuvenation effect with really no pain and no downtime. It's appropriate for all skin types, and we don't pre-numb or anything like that with this device. We can use it for acne scarring as well, and like I mentioned, tattoo removal and spot treatment. So the first thing we're going to do is try to spot treat some of these brown spots with our 532 nanometer wavelength, and we're going to use a low setting, and we're going to gently target these brown spots. And you can see as I treat the brown, there's a little white frost that develops, which is the endpoint that we're looking for. Really gentle, comfortable procedure. And then turn toward me. Great. So again, we can get into these small areas, crevices between the nose and the eye, and use this as a little pen for patients who have treated and had great results. They like to call this the magic wand. Okay, so now we're going to switch to the 1064 wavelength to do that toning type procedure that I mentioned, which will help stimulate collagen, help with cell turnover, yet be very easy recovery. I never like to spot treat as a rule. I like to treat the whole face. So even if you spot treat brown spots, then you should kind of finish off and treat the whole face because nobody wants to walk out looking spotty. Just a day in the life. I think we are still good about doing it now.